I'll just say a word or two about how I got involved in VWD outreach as a junior faculty person at Duke University in North Carolina, having trained at the University of North Carolina in OBGYN, which was an epicenter for bleeding and clotting, and found out that I had an advantage over my colleagues in that I knew a little bit more about bleeding and clotting and became the go-to person. And very soon after I got there, I had a clinic for women with bleeding and clotting disorders because they were preferentially referred to my clinic. The Centers for Disease Control connected me with the National Hemophilia Foundation. I served on the Women's Task Force for years. We oversaw the Project Red Flag, which was a model partly for Code Rouge. 7 years ago, a group of us decided to focus on provider education, and we are the Foundation for Women and Girls with Blood Disorders. Project Red Flag had as its mission to increase the awareness not only of prospective patients and the public, but providers, which is a theme I heard here, and policymakers and government agencies. How do we raise the awareness of the policymakers and government agencies that we have to work with? Our national organizations, our world organization have done a good job, and of course there's always room for improvement, of increasing awareness among the public and potential patients. But how about working with government agencies and insurance companies, et cetera, to get what we need for our patients and to allow our providers to work? How did you work with government agencies to accomplish what you did?
We started with two university hospitals, and we had like two postgraduate theses for two candidates, so they could get the IRB approval for the two studies, and out of which we could have these results. Now we have a dialogue, because most of these patients are looked up by the health insurance. So the NMO has an agreement with the National Health Insurance to have a collaborative work on different aspects of bleeding disorders. Where we provide education, we cooperate with the World Federation of Hemophilia to invite international experts to speak. And with this, we increase the knowledge in the network of the National Health Insurance. But usually, we have the referral laboratory. So they send to us, and we do this free of charge for all the...
Okay. So it's a value add to the health system.
Yeah.
Amy, do you want to comment on that in Canada, where you have a very different health system than we do in the United States?
Yeah, for myself, particularly in Code Rouge, where we're speaking directly to the public, these are stories that we hear quite a bit. And we do hear about, in particular when you said insurance, that really jumped out at me, because I have had an experience myself, and I've heard of experiences of women who have been denied medical coverage because they don't fit the framework of a bleeding disorder the way that it currently is published or that it's governed. I went through an experience where our family was denied medical coverage, and essentially the bottom line was because I was female and because I didn't fit the parameters that the bleeding disorder fell into. I do sit on the board of directors as well for our provincial board, and this is something that I'd like to say has become a more forefront issue, that we do need to start lobbying. It's hard to go to a government agency and say this is what we need and this is what we're advocating for, when you look back at our centers and, as a couple other people were saying, an obstetrician gynecologist isn't a part of the comprehensive care team at this time. We are beginning to establish women's clinics, but it's a slower process, and it's something that we are still building. So at this point, I think we really need to just look internally. What vocabulary do we have in our governance policies or in our comprehensive care programs? Is it focused on female? Is there a female section? Do we have that coverage within our own medical community? I think we've made very big strides in the right direction when it comes to, treatment for all. To me, also means gender equality. And it isn't just socioeconomical or across the world. You know, achieving treatment for all, in my mind, is also VWD and for women. So at this point, I think our biggest focus, at least in Ontario and in Canada, is raising diagnosed women, getting people in databases, referring them to clinics, showing there's a need, showing that there is a change in their quality of life. And the conversation's starting to open about how we're going to treat women's needs differently, because right now we are all essentially evaluated and treated the same as our male counterparts and as our hemophiliac counterparts.
Thank you very much. I met a woman here who was being treated for her heavy menstrual bleeding by her hematologist, and she had never had a gynecologic exam or seen a gynecologist. Well, we need to start there, work together. Peter, how were you able to accomplish so much? You certainly couldn't have had the government in your way. How did you work with government agencies or national insurance to accomplish what you did in Beirut and the Bekaa Valley?
You know, in Lebanon, it's a very complicated system because it's divided in many third-party payers, we call them, those who are working in different societies and establishments. They have the social security. We have the other governmental coverages and the private insurances, and those who have nothing are covered by the Ministry of Public Health. Unfortunately, the private insurances do not cover all the genetic disorders, so they are excluded. For this reason, insurances do not cover our hemophiliac patients, our vulnerable patients, or the patients are not covered by the insurances. So the government...
That's diagnosis or treatment or both?
Diagnosis, maybe sometimes we can ask for diagnosis, but when the diagnosis is established, so the treatment will not be covered by the private insurances because they consider it's a genetic disease, so no, it's not covered. In this particular case, the Ministry of Public Health has to continue and to afford the treatment for the patients. And this is a big challenge because the Ministry of Public Health, specifically in countries like Lebanon and in the region where other priorities are most important than hemophilia and other bleeding disorders, we had with the Lebanese Association of Hemophilia to go many times to visit the minister himself and to tell him and to talk with all the key leaders and all the governmental coverages that this is a very important disease. This is important. It's important to be covered by the Ministry of Public Health and other governmental coverages. Slowly, since 2005, we are increasing, and specifically when the gap with the World Federation came to Lebanon also in 2006, we increased the awareness between all these institutions, and the Ministry of Public Health now has increased the budget for these rare bleeding disorders. We are still not in the optimum. Year after year, it's better, but still we are far from what we need. And for the study we have done as outreach in the Bekaa, the Ministry of Social Affairs helped us a lot because these specific dispensaries and small clinics, as I said, are directed by the Ministry of Public Affairs. So they opened for us these clinics for the awareness and for the study and questionnaire for these women.
How about in your country? How did you work with the Mexican government or insurance agencies to accomplish what you did?
Okay. In the case of Mexico, and in my institution, it's a researcher center. There are 5 in our country that are part of the Mexican Institute of Social Security. So the purpose of our center is to develop diagnosis and to improve the management of medical health care. And in around 60% of all the population has incorporated to this kind of social security system, and now all the organization of a federal hemophilia organization has fight very, very strongly more than 10 years ago, 20 almost 20 years ago, to encourage the support from the government to cover all the treatment for the bleeding disorders, genetic bleeding disorders. Now we have national guidelines for the treatment of the patients, so at least around 60%, 70% of our population are covered. We have a right to the treatment incorporated to this kind of system. Until now in our country, a lot of patients don't have the diagnosis. That is why it's very important for our country to have this kind of program. But it's becoming to have, and right now it's a very strong initiative from the organization of hemophilia, the physicians, and also from the enterprises, the pharmaceutical companies that work together to fight for to have this treatment for the patients.